Welcome to the DoubleACS Daily News for October 2nd, 2017. The Murray Unitarian Universalist Church hosted a vigil and drop-in clinic for those with opiate addiction late last week. The event was also one of the first events of the Greater Attleboro Recovery Network, a partnership between Arbour-Fuller Hospital and the Attleboro Police Department to address opiate addiction in the area. We spoke with Attleboro Police Sergeant Steve Beaudet to learn more.
Tonight we're at the Murray Universalist Unitarian Church on North Main Street, and we're having the first ever You're Not Alone drop-in center. And we started the night with candlelight vigil, remembering those who we've lost to not only opiate addiction, but also suicides. 2069 refers to the number of lives lost in Massachusetts alone last year to opiate addictions. And those are the ones that are confirmed. The medical examiner's office isn't always able to confirm opiate usage as a cause of death.
We are here to help those who are continuing to struggle and who show hope. And we're here to remember those we have lost and the work that we need to do to eradicate as much of the crisis of addiction as we possibly can, and also focus more on providing quality care to those who have mental health needs. There's a lot of comorbidity with mental health and addiction. They do work hand in hand. We see that firsthand at Fuller. We have a lot of dual diagnosis individuals that come to us. Mental health and addiction to me are kind of sister chronic illnesses in my book, because they're both chronic illnesses that don't necessarily relay or show obvious symptoms or require the more traditional medical treatment. So there's still a lot of stigma as to whether someone's really experiencing certain types of symptoms that are mental health or addiction related, or whether addiction is just because they're too weak. That's a big one. Are they being weak? The question I hear a lot, especially when I'm out in the community, is people frustrated because their taxes are paying for Narcan, or they think that, why are you continuing to resuscitate somebody for the 5th, 6th, 7th time? And the reality is, they are someone's mother, they are someone's sister, brother, cousin.
Late in 2013, early in 2014 is when we first really saw this current wave of how bad the opiate addiction problem had become in the area. And early on, Chief Hegney recognized that traditional law enforcement treatment of opiate usage wasn't going to work. He mandated my predecessor, then Sergeant Timothy Cook Jr., now Detective Lieutenant Timothy Cook Jr., with coming up with alternatives to the way we've been doing it, to include home visits, helping people in recovery get jobs, helping the families with support, and bringing in other agencies to offer any and all help to someone in need. There are a number of resources that can be accessed, but it can be overwhelming. It can be scary as someone in acute need of treatment trying to navigate through the insurance mess and who do I call and where is there a bed available. That's one of the things that my team does. If you're in acute need, we reach out to us and we'll do everything we can to find you a bed and get you to that treatment that you need. We've done it for the last 3 years. We're going to continue doing it. We can't arrest ourselves out of this opiate addiction problem. We're here to help. You're not alone.
The Attleboro Police Department have been fantastic about wanting to launch it. It's been an honor, and I'm speaking on behalf of myself and Arbour-Fuller to get this seed planted and to actually make this kind of impact in our community. The You Are Not Alone drop-in center by the Greater Attleboro Recovery Network, or GARN, will be meeting monthly. And so you know that the last Wednesday of the month at 5:30 to 8 o'clock, you can come to the Murray Unitarian Universalist Church at 505 North Main Street, and you can access services between, again, 5:30 and 8. We'll have the same resource tables set up. We'll have clinicians on hand to help and just, again, guide you through whatever your needs may be at that time. We really respect anonymity, so we really want folks to feel like they're safe to come here and to talk about what's going on and to seek help and treatment.
That's it for today's update. For DoubleACS News, I'm Austin Ricketts.